Welcome to the deep dive. Today we're jumping into something pretty common, but often a bit mysterious. Urticaria. You probably know it better as hives.
That's right. We've looked through the source material you sent, which explains the condition, and we're going to pull out the key things you need to know.
Our goal here is basically to understand what they are, maybe why they appear so suddenly.
What your body's actually doing, and importantly, when you should, be concerned.
Okay, let's get into it. So what are hives exactly? The material describes them as sudden raised welts on the skin and really itchy.
Yeah, think mosquito bites almost, but they can just appear out of the blue and sometimes cover big areas. They're usually red or maybe skin-colored bumps.
Right, and the source mentioned they often have a sort of paler center, and they can be different sizes, sometimes even joining up.
Exactly. Tiny spots, big patches, but the defining thing, like you said, is that itch. It's usually pretty intense.
Okay, and there was something interesting in the source about how long they last. It sounded a bit strange.
Ah, yes, the timeline. This is fascinating. A single individual welt. It
Hmm.
typically fades away within 24 hours, often, much faster, maybe just a few hours.
Wait, really? Just a few hours? But people can have hives for days, right?
They can, and that's the peculiar part the source highlights. The overall outbreak can continue because as old whelps fade,
New ones just pop up somewhere else.
precisely.
Hmm.
So it looks like they're sticking around for days or weeks. But it's actually a constantly changing pattern of new welts appearing as old ones resolve. Very distinctive for urticaria.
Huh. Okay. So where do they actually come from? What triggers them?
Well, the source breaks it down. A lot of the time, it is an allergic reaction. That's probably the first thing people think of.
Like foods, peanuts, shellfish, that kind of thing. Or maybe medicines, insect stings.
Yeah, all those are common culprits, even
Yeah.
things you breathe in, like pollen or pet dander. But, and this is important,
Isn't that always an allergy?
correct. The source really stresses that non-allergic triggers are very common too. Things like physical pressure on the skin, maybe from tight clothes,
Oh, interesting.
or cold, heat, sunlight, even exercise can set them off for some people. Stress is also mentioned, and sometimes the cause is just unknown, especially with chronic cases.
Right, a mystery trigger. So underneath the skin, how does the body actually make these things happen? What's the mechanism?
Good question. The material explains it often comes down to a chemical called histamine. Your skin has these special cells, mast cells, that hold histamine.
Okay.
And when they get triggered by an allergen, or maybe one of those physical things we mentioned, they release that histamine.
And the histamine causes the reaction.
Pretty much. It makes the tiny blood vessels leak fluid, causing the swelling, the redness that's your welt. And it also irritates nerve endings.
Ah, hence the intense itching. Got it.
Exactly. So histamine is a key player in creating those classic hive symptoms.
So the big question, is it serious? Do you need to worry if you get hives?
Generally, no. The source is quite clear that most of the time, hives are just uncomfortable. Annoying, definitely, but usually harmless. A skin-level reaction.
But there's a but, isn't there?
There is. And it's a crucial warning in the material.
Yeah.
If the hives come with other symptoms, especially swelling of the face, lips, tongue, or throat,
Or trouble breathing, feeling faint.
yes, that signals a potentially severe whole-body allergic reaction called anaphylaxis. And that is absolutely a medical emergency. Needs immediate help.
Okay, that's really important to note. So emergency signs aside, hives are usually just itchy and temporary.
Right. Bothersome, but benign in most cases.
So wrapping this up, what's the main takeaway?
Well, hives are common. They're these itchy temporary welts, triggered by all sorts of things, allergies or not, often involving histamine. And remember that weird timeline, individual spots fade fast, but new ones can keep the outbreak going.
And if you're getting them a lot, or they're really bad.
The source suggests seeing a doctor, definitely. They can help you try to figure out triggers, maybe you discuss treatments if needed.
Makes sense.
And here's maybe a final thought to leave you with, thinking about this. Isn't it kind of amazing how specific things like a peanut protein or just, cold air
Yeah.
can trigger such a rapid visible reaction from just those little mast cells in your skin?
Yeah.
It makes you wonder about the incredibly complex, sort of intricate ways our bodies are constantly reacting to the world, right down to that single itchy spot.